Now, see, what happens is that sometimes you have already got that bad experience, right? About
Right.
going to someone who has not listened to you, not heard you, not tried to help you. You were in pain, and they still were like, okay, or they have not answered you correctly. So, in between treatment, you cannot switch.
Right.
So, what can one do to make things a bit better with their current scenario? Or how can one find a right dentist also is a very, very important factor.
See, by and large, I think most of the clinicians are competent enough. I don't think it's that big a problem per se. If you are facing something going on currently, it is very important not to jump the gun, first of all.
Okay.
Because at the end of the day, the clinician who has started the work will scientifically know what is to be done, first of all.
True.
And he will have a plan in mind.
Huh.
When you change in between procedure, you're tinkering with that plan unless something drastic has happened.
Right.
Right? If the soft skills are in soft skills means what? Way of communication.
Right.
Unwillingness to communicate or answer. If all this is an issue, I think a small conversation should solve. Okay, doc, can you please be more patient with me? I understand I may be taking more time, but I will not be happy, or I am not at peace when I go home. If you've had that conversation, and still if things are not figuring out, then you have all the rights. To go to whomever you want.
Yeah, exactly.
But till the time I don't have such conversations, I think you should never jump the gun.
Right.
It's like any relationship, right? If you are having some problem
Try
with
to
a
solve it
girlfriend
with communication.
and you don't tell her, and you assume everything to be fine, suddenly what happens? You break up after 2 years. ये तो सुनते ही नहीं है. अब बोलोगे नहीं तो सुनेगे कैसे? है ना? और vice versa.
Are you comparing a dentistry and a patient relationship to actual relationship?
I feel any relationship, the principles are the same.
Communication, yeah.
The protocol is different. Some relationships are professional, some are personal. The basis and the foundation is same. No, communication, trust. These are the foundations. No, understanding.
Absolutely.
So we are humans, not at the end of the day.
Yeah, true.
So human to human relationship is always the same. It's not someone whom you are going to meet once and not see again. Your doctor you are going to see time and again.
Absolutely.
Family doctor concept in India is so old. Family dentist concept is so old. Why? Generations together, you're there with one person. On the basis of what? Basis of trust, no?
Trust and communication. Yeah, because you're so comfortable speaking to them. That's how it
far
works.
Better to have a good clinician and an excellent communicator than have the best clinician in this world but not being able to talk to him.
True.
It's far better in any profession. So I
absolutely.
feel conversation solves everything.
Everything.
And then you should also try and just, as you spend time, you may just accept certain things. For example, my wife may feel I'm a little direct in my approach, but she knows he's direct now. She's accepted me, over a period of years.
Right.
I know this is the way she communicates. I don't feel bad about it.
Right.
So you should not jump the gun.
Okay.
I feel these days people are jumping the gun too soon.
Or maybe they're not able to just find the right doctor.
Because there are so many clinics around, no?
I think especially in the tier 1, tier 2 cities, there are a lot of it. I think tier 3 and 4 are still coming up.
Yes, they are coming up. So now people are taking decision based on who is nearest, who is not that expensive, and stuff like that. These are not the correct criteria. All of them are good. Whom you are clicking to on a personal basis, whom you are happy with, is the person you should stick with. We are practicing in near Link Road in Goregaon. We have patients coming in from Bandra, patients coming in from Ghatkopar, patients coming from Chembur, from Borivali. They're spread out. It's not like
it's not that they're coming in from the locality itself.
No, it's not like that. Those things are changing.
And I think as much as I've understood yours as well, that you have not even put up a big board. You've only relied on the referral that you're coming through your existing patients.
I run my practice completely on referrals. I want only and only my skills and my approach to be the marketing agent. My patients are my friends. And my patients refer me more patients.
Right. And that's
my colleagues refer me patients.
Okay.
The other dentists refer me patients because I'm a specialist, which we'll talk more about as the interview goes further.
Yeah.
So I run my practice purely on referrals.
Good. It's true. Good.